Hi, I'm Dr. D, also known as Duncan Pelly.
I'm Dr. Emily Bailey, and I'm an assistant professor at Texas Tech Health Sciences Center in Abilene, Texas.
Well, Dr. Bailey, tell us just a little bit more about your professional background.
I studied at the University of North Carolina in Chapel Hill at the School of Public Health there, and my background is in environmental health, environmental science. And what I did while I was in graduate school is mostly water microbiology, looking at water and wastewater systems. And when I did a postdoc, I mostly focused on virology and zoonotic pathogens. I teach our Intro to Environmental Health class, which is our core environmental class. And I also teach environmental epidemiology, which is an elective in our program.
Now, I'm sure there's a really good story behind it, but how did you get involved in this field?
It is a funny story. So I went to undergrad thinking I wanted to do public health, but I didn't know what kind of public health. I just wanted to do public health and have some sort of impact on people. And when I was looking for research opportunities, I started in a cancer lab, and I was doing this big breast cancer project, and it was literally thousands of cases of breast cancer. And I said, I cannot do this for the rest of my life. And so I went over to the School of Public Health and literally cold emailed every professor in environmental science and talked to the ones that emailed me back. And at first I talked to someone and she was like, I don't have a lab. I don't know what you would possibly do with me. And then she sent me over to someone who I actually hadn't emailed. And he said, yeah, let's go see the lab. And he walked me up 3 flights of stairs. Of course, he ran up them and I was struggling as an 18-year-old. And we saw the lab. I had a project that day and I was in his lab for 7 years. And by the end of my time, I was managing his lab and his research. And it all stemmed from these cold emails and a student trying to find a spot at a university research lab. But it was really fun, and I wanted to do something in the field where I was actually collecting samples and I could see a practical impact. And that's kind of how I fell into viral research. It's because of my dissertation work. I had a high amount of viruses in the samples and we didn't know why. And so I went on to do a postdoc where we could figure out how to do more virus sampling and look at what happens when viruses cross over between animals and humans.
And you mentioned, this whole idea of viruses crossing over between animals and humans. You called them zoonotic pathogens. Is that right? Could you tell us a little bit more about that?
Sure. So zoonotic pathogens are typically ones that cross between animals and humans. And the one that everyone is familiar with right now is SARS-CoV-2, or what causes COVID-19. And this typically happens when people mix with animals or there's some sort of eating of a wild animal or living with animals in close proximity to people. And so what I've done in the past is search for these pathogens on large swine farms or in live bird markets in China. And in the US, I've worked on, like I said, swine farms in North Carolina. In Texas, I'm working hopefully to work with the wild pig population, which everyone hates. But that's kind of the direction of zoonotic pathogens right now for me. So I right now have kind of shifted and I'm working a lot on COVID-19, and I am doing a little bit of animal work, but largely I'm working with a couple different universities to track SARS-CoV-2 transmission in their student populations, a lot of it in athletics to see how it transmits between students when they're participating in sports. I'm also working with a group to look at telemedicine and how rural areas are transmitting SARS-CoV-2, because a lot of these areas have higher populations of animals. They might have cows on their property, or they might have goats. There's a lot of goat farms in West Texas. And then some of the other things that I'm working on, I have a global project in Iraq. Unfortunately, all of that's on hold because we can't travel right now. My passport is actually at the State Department because I need to have it renewed. But that project is to build cell culture facilities in a lab there. And the idea is to help them detect these zoonotic viruses in their labs.
Well, if you like, walk us through the presentation that you gave yesterday.
Sure. Yesterday, I talked about zoonotic pathogen detection in waste samples. So on swine farms, there's a huge waste problem. We think about how much meat that we consume as a society, and we don't necessarily think about where that comes from. But our model in the United States is to produce hogs on these large confined animal feeding operations, CAFOs. And when you do that, you end up with large piles or large lagoons of waste. And so what we were doing is looking at a way to track pathogens in the waste before the pigs are sick. And the reason you want to do that is because once the pigs are sick, it passes really quickly. So just to give an example, we saw that with COVID-19. Once one person was sick in the United States, lots of people got sick. The same with pigs in a barn. Once one pig is sick, tons of pigs are sick. So if you can find it in, say, waste or wastewater before all the pigs are sick, you can say, let me isolate this pig or that pig. And the reason that waste is an exciting way to track, well, not necessarily exciting, but the waste is a better way to track pathogens is because when you collect samples directly from a pig, it's very difficult. It interrupts production, and catching a pig is not the easiest thing to do. Typically, it takes 2 or 3 people, a veterinarian, and pigs are not, agreeable to having their blood drawn or a nasal swab taken. The same with people. You have to agree to it, and a pig is not necessarily agreeable every time you want to take a sample. So waste, you don't need their permission. You just take the waste sample, and then you can test it.
Did you have any surprising findings in your research?
I think some of the most surprising findings were the amount of antibiotic resistant bacteria we found in the waste, because supposedly that kind of production usage is declining in the United States, but it looks like they're still being used either to treat disease or as growth promoters. And we can kind of back calculate what the pigs are being given, but it does look like they're still using antibiotics in either the feed or in their treatment regimen. Some of the other things we found were some novel viruses. I didn't present on this yesterday, but there's a paper that we're working on is on a couple of novel things we found in the swine waste, some new viruses that are, not currently documented, and what that actually means, don't know yet. But there are lots of, I think there were 12 new ones that we found in the waste.
So can some of these diseases that are in animal wastes make their way into like water supplies, for example? And is that a way of helping to transmit to people as well, or?
Yes, so what actually happens with these swine waste lagoons is that when the pigs poop, the poop falls down through the slats of the barn, is collected in a big pile, and then it is slowly shifted into a lagoon. And that lagoon it sits for a long time, and then the water at the top of the lagoon is sprayed onto the field. So the field surrounding the swine barn. So anything that's in the waste that doesn't degrade over 6 months to a year can definitely end up in the water supply, because it's going to be field applied to grasses or hay. It may even be fed to cattle later. And so the runoff from those fields definitely end up in water supplies, rivers, reservoirs, things like that.
Now, you also talked about you do research on One Health. Could you tell us a little bit more about that?
Sure. One Health is a concept that brings together multiple disciplines to work together to solve problems. So kind of what the group, the water storytelling group, aims to do is to bring together multiple disciplines to solve water problems. And that's the same kind of idea with One Health. in that you need more than one discipline to actually solve a problem. I, as an environmental scientist, am not capable of, solving zoonotic transmission of disease. I also need medical doctors, veterinarians, economists, a whole list of people who are well trained in their fields to be able to solve these types of problems. And that's what One Health means. It means we have to come together to solve problems. We need a group, and we have to come at problems from that group mentality. I mean, we need social sciences to help us understand some of these problems. And I think, that's left out a lot of the time, and we sort of ignore it, but you can't solve problems. It's like, you need planning, you need policy. Otherwise, the scientific intervention doesn't work.
And that kind of reminds me, the kind of impetus for having a water storytelling talk that featured, people from the science community. David had made a comment a couple months ago, and he said, well, one of the things that we can contribute working with scientists is hopefully that we can compose kind of a coherent narrative between sciences and then the social sciences, or between life sciences and social sciences. And I said, oh my goodness, but I bet you none of us really know what the conversations are in the science community. And so that was kind of what launched this idea. And so my question for you is, based on your research, what kinds of stories or messages can you give to, for example, people in businesses, inside of government policy planners, and then also just for everyday people, your members of society, your customers, et cetera?
So I think what the messaging actually needs to be is that solutions have to work for everyone. They have to work for the consumer. They have to work for the business. They have to work for practically the science side. We want to protect human health. We want to protect public health, but we can't do that to the expense of producing food or, crashing our economy or anything like that. And we need different perspectives in order to make sure that we balance all of those things. And I think that's kind of what this storytelling approach, this One Health approach brings to the table, is that we have to all bring our, our expertise, our cards, and we have to say, this is the practical solution from my side. How can we work together to solve this problem? I think it's thinking about what kind of choices you make with your money. So if you're interested in preventing spread of zoonotic pathogens, you have to think about, what kind of meat that you're purchasing. Where did it come from? Sustainably produced meat is likely a better choice. And that doesn't necessarily mean it wasn't produced on a CAFO, a confined animal operation. It just means that there are some companies that are taking steps to reduce the use of antibiotics. There are some companies that are taking steps to reduce land application of waste. And we can choose those companies when we buy products. The same with, preventing water contamination. We choose what we throw away and we choose what we recycle. And, we have to be responsible for handling those decisions at the household level. And if we don't, then our representatives are never going to see that it's important to us.